Absolutely, absolutely. Another portion of, and a huge portion of this initiative is a website called Mass in Motion. So if people want to go and take a look at it, is www.mass.gov/massinmotion. And this website has a ton of resources around mainly how to eat more healthy foods and how to exercise more. And it's funny that you would mention the gardening, because one of the latest postings, we actually have a blog too tied into Mass in Motion. And one of the latest postings in the blog is, it's that time of year to grow your garden. Here are some tips if you're thinking about doing that. And so the website is a great tool. We have also a new feature on the website called Ask a Dietitian. And this is great because people can actually, and have been, posting questions. And there are certified dietitians at the Department of Health who are answering actively these questions as they're being asked.
Oh, and see, that was actually my first career.
Really?
That's what I studied in as a nutritionist dietitian. And of course, that was many years ago, and haven't kept up as much as I should with a lot of the new innovations. But, there is so much now about learning from dietitians, people who have their registration and really have an understanding of the most recent data, because it's changing all the time.
Right, right. And also, there are people who have very specific problems, health problems, and they need to ask somebody who's qualified to answer. I'm on these kinds of
allergies.
Allergies, medications, if you're on different medications, if you have certain underlying conditions, can I eat more of this, less of that? Is it safe for me to eat certain kinds of foods? So it's not that one size fits all. So it's great that we have these dietitians that are answering people's specific questions on a daily basis.
Oh, that's wonderful. And as far as the disparity, because I found that very troubling, and particularly young people now, because unfortunately they're not as active. And you mentioned some of the particulars where maybe they don't have a big yard, or they don't have a place to really ride their bike. That's really a sad statement, but hopefully there are lots of programs out there that are going to reach out to children in poorer neighborhoods, no matter what their background, and provide some of those resources by having being able to get involved, being more active, burning off those calories, and doing it in a way that's fun and enjoyable, and not really viewed as, oh, gee, I have to go and work out.
Absolutely, absolutely. There are many ways in which we can become involved and be more active. Another piece of the website is a calendar. So people from across communities in the Commonwealth are submitting events that are happening in their communities, walks, different activities to do with children, adults, senior adults. And this is a great way of people from across the state, or even a neighboring town, knowing what's going on and how they can become involved. You were mentioning about restaurants too, and the kind of food that is being served, and how some restaurants are trying to turn to healthier choices, healthier ingredients in their food. We are not necessarily, the state is not necessarily telling restaurants what they should be serving. One of the pieces of the initiative is that chain restaurants, fast food restaurants mostly, will have to post, this is a proposal that hasn't been voted on yet, but that fast food restaurants, chain restaurants, will have to post the caloric content of the food they sell visibly, because many of us don't know.
And maybe if you did know, you might think twice. Absolutely. Before ordering that extra large order. Because you know how they have, for 15 cents or 20 cents more, you can get an extra supersize it or whatever. But if you could see, first of all, what the small bag of French fries is, and then the supersize, versus do you really have to have the French fries at all? Is it the end of the world if you don't have that?
Exactly. And we have seen that that's been done in other states. New York City has something very similar. And we have seen that does work. People come up to the register and they look at the menu and they see how many calories the food that they're about to order has. And so they turn to something that has fewer calories. So that has shown results, and we are trying to implement the same here in Massachusetts.
That's good. Now, I know in a lot of the schools, and sometimes there's been a little bit of controversy. I remember when I was in high school, we kind of had our candy store at the back of the cafeteria, and you could go buy that. But I know a number of schools, public schools, private schools, are trying to actually limit a lot of the sugars and sweets that the kids are having, or limiting the cans of soda, which, when you just talk about empty calories in a can of, I won't use any brand names, but a can of soda, right. And just the sugar that is in that and no nutritional benefit whatsoever.
Exactly.
And so we really have to start rethinking what people are putting in their mouths, because it's having a huge impact. And I think also when you have young parents who may not have the appropriate nutrition education, I don't know how much that is within the curriculums anymore. They're not even getting the basics in school, so we really need the Department of Public Health and others to really help. How do we get through to children, to parents, to adults, to our seniors? Because no matter where you are in your life, it affects your life and it affects your well-being. And it costs the state and the federal government huge amounts of money in health care when you don't do the right thing, because it gets to be very, very expensive, all these related diseases that are a result of obesity.
Exactly, and it